Hello, we are here in Maison Lutetia with Dr. Adnan, and we are going to talk about liposuction.
Okay, so liposuction is a very common procedure done worldwide, which involves removing of fat cells under general anesthesia, where patients are put to sleep, or some surgeons prefer to do it under what's called a sedation or a regional anesthetic as well. Now, it's performed in millions of people worldwide, so it's extremely popular. It has certainly evolved over the last few decades in terms of the machines and devices that are used to remove the fat. So it's not just as simple as removing the fat nowadays. It's actually sculpting the body to get the desired result. So people use various terms like liposculpting, lipomodeling, and so on. There have been huge technological leaps in the energy-based devices and other devices as well for this purpose. Liposuction is also occasionally combined with fat transfer, where the fat is removed and then placed to another part of the body to usually augment or correct any contour issues. So let's talk a little bit about the different devices available. So broadly speaking, they are energy-based devices which give some sort of thermal insults to the fat cells and assist in removing them. So you've probably heard different types of names such as Vaser, J-plasma, and so on, and they are all energy-based liposuction devices. Then there are the water-based devices. The more popular one that I prefer to use is the body jet system, which uses water jet technology to remove fat cells. It's a bit like having jet wash to the car, so that uses jet wash technology at a microscopic level to remove the fat cells. And then there are the mechanical devices which use vibration tools to remove or dissociate the fat cells from the body. And then there are various types of names and devices in relation to that. So I personally, as a plastic surgeon, evaluate each patient differently. So for me, I would always, at the time of consultation, address patients' needs as to why they want a liposuction and take a detailed history for them and know their expectations. And then at examination, I would determine which device is probably best to serve their needs. There are some patients who are suitable for Vaser, for example, and there are some patients who are suitable for body jet, and there are some patients who are suitable for both. However, a word of caution: liposuction has never had been a weight loss operation, so it's not a type of procedure where patients should expect to lose weight. However, stubborn areas of the body, such as, for example, love handles, abdominal fats, arms, inner thighs, liposuction indeed is the gold standard to remove fat cells from there and contour the body. So I would say over the last few decades, liposuction has indeed been evolved over time, and now it's like become an art form. So it's like almost making a little painting out of the various parts of the body you're trying to sculpt. And that's where the words like high definition have come into play, and that's where liposuction now has become a very precise, specific operation, and the outcomes certainly are very much different to what they were a few decades ago in this regard.
And who are the best candidates for liposuction? Who should consider this surgery?
Okay, so the first thing to do is to seek a board-certified plastic surgeon who's got plenty of experience in liposuction if you're considering this type of procedure. At the time of the consultation, I personally will take a detailed history from the patient of the medical problems, things like recent weight loss, weight gain, what the expectations are. Of course, the BMI is very important, and if, for example, personally, if somebody is in the obese range, then I would not recommend liposuction for them, and in fact advise them to reduce weight. And that's another science altogether, where there's dietary influences involved. There you can use surgical influences which general surgeons perform, which are come under bariatric surgery, such as gastric bypass, gastric Botox, and these type of procedures where you can lose a lot of weight. So certainly liposuction is not for that group of patients. So certainly there are clients who come to me who are indeed obese and In my view, I say to them, liposuction is certainly not for you, and I guide them in the right direction to seek help from a bariatric surgeon. So those things I evaluated at the time of a consultation in detailed history. Of course, somebody with severe medical problems like uncontrolled diabetes, high blood pressure, other wound healing problems or previous heart disease or issues are also a relative contraindications for this type of procedure. So these things are evaluated at the time of consultation. Ideal candidates for liposuction are people who got the excess stubborn fat in areas such as arms, stomach, chest, thighs and so on, where they've tried a period of exercise and tried to lose weight and are finding these areas resistant to that. I think those are the ideal patients with a reasonable BMI, something in between 22 to 27, 28 in my view, are the best candidates for this.
I see. And the patient needs to see result directly, and they will see improvement directly after the surgery, is it right?
So, of course, there's a recovery period. I choose to do liposuction procedures preferably under general anesthetic because that gives me more control and time to sculpt the body the way I want in terms of achieving the patient's expectation and desired results. The recovery period involves 2 or 3 weeks after surgery, whereby there's some swelling, there's bruising, the patients have to wear a garment, although they see a difference straight away after surgery, but the final result can take 3 to 6 months after the procedure is done. And of course there's a maintenance element involved, which patients forget about, where liposuction is not the solution to suddenly a great body that one should expect. There is a maintenance phase after that, so I always counsel my patients and I say, look, liposuction is like a kickstart to changing a lifestyle. So I can start that process, but in the long run, it's the patients who will have to maintain that result by changing their lifestyle in terms of dietary habits, mild to moderate exercise and so on. So it's not a one-off solution. It is a joint decision that we make with our patients to achieve long-lasting results.
I see. And you know, there is a lot of medical terms like fat grafting and fat transfer, and I know that patients, they always get lost. What is what, and can you explain what is it about?
Good question. So there's a lot of media hype and media-driven terminology that has come out from liposuction or lipomodeling based procedure. I'll give you a few examples: the Brazilian buttock lift, the S-curve, and the Vaser HD, the six packs, and all those things are associated with a specific type of liposuction devices and procedures. From my point of view, I look at every patient's unique and their body is unique, and I try and achieve anatomical results which are unique to that patient. So for example, a Brazilian buttock lift may not be ideal for everybody, and that involves fat transfer to the buttock and contouring the waistline and the inner thighs. A patient evaluation is the key for fat transfer procedures. It's certainly not for everyone. I use it a lot in my practice for using fat grafting techniques to augment the breast by maybe, let's say, a cup size, and to shape the buttock area and waistline to get rid of contour irregularities. For example, patients may have a square buttock outline or a V-shaped buttock outline. You can create sort of so-called S-shape waistline and buttock through fat grafting and liposuction. So I certainly do that in my practice.
And what about skinny patients? If they don't have excess fat and in their body, what are those places where you can get fat from?
Good question. So if somebody's got no fat at all whatsoever, then of course they are not the best candidates for this type of procedure. So broadly speaking, then they have two options. They have an option of gaining weight first, which is temporary, and then we can use the fat to augment whatever area they wish to augment. Or if they are unable to do that or don't wish to do so, then of course you have to think of other things such as fillers, for example, which can be used to a degree to change shape and contours, but they do have limitations in terms of volume that could be injected, and it's not your own cells that are doing the work, so there are certainly limitations with that.
And what about the result? Is it permanent in the end, or it's just for a period of time?
So once fat cells are removed from the body, they are permanently lost. They don't come back. However, there are existing fat cells which can still store more fat. So a lot of patients would have this misconception that once they have liposuction and that's it, they'll be okay for a long period of time. And I think that depends on the patient's lifestyle and dietary habits and exercise routines and so on. Mm-hmm. That is not certainly true. So after liposuction, there will be some fat cells left behind which can still store fat if patients are not careful. So in that terms, I think maintenance again becomes very important. In terms of longevity of the procedure, if patients maintain the result long term, there's no reason why you can maintain that result for a long period of time. I've seen patients 5-10 years after this type of procedure, and they get better and better because they've maintained after and looked after themselves in this regard. So one thing also to understand is once we transfer fat cells from one area to another, they're still your fat cells, so which means they can still store fat. So for example, if you gain weight, the area where you've done the fat grafting will also increase in volume and size. So that's something also to understand.
Perfect. And what are those areas which you can fill with the fat in the body?
Well, you can pretty much fill fat anywhere, but however, the commonest places where people ask for volume-based fat grafting are the buttocks and the breasts. Yeah. Occasionally we use it for other pathological conditions like contour irregularities. Let's say if someone's had previous liposuction, let's say done perhaps badly, then fat grafting may help address those contour issues. Or sometimes bad scarring, fat grafting is used in, and I think fat cells harvested properly, and I use the body jet system for that, they are rich in stem cells as well. So they can actually rejuvenate structures such as skin.
Amazing.
So they certainly have a role, for example, when I do a facelift surgery. So microfat grafting to the face to add volume where it may be lost with age is certainly another area where fat grafting is extremely useful.
Amazing. And in social media you see a lot of pictures of six-pack stomach, and and it's getting very popular. What do you think about that?
Yes, I think these are again social media driven things. They're not for everybody. Certainly you can create shapes, shadows and lines using energy based devices such as laser, for example, in combination with traditional liposuction. And although I'm personally not a big fan of it, a lot of surgeons would prefer to inject fat into the muscle itself to create those type of shapes and so on. So word of caution on that. I think these results may over time look quite dreadful if patients are not careful and don't maintain those results. So you might have a short-term gain, but long-term you might look dreadful as a result. So although using traditional laser combined with standard water-based or mechanical-based liposuction devices can achieve those type of results in selective patients. So these are ideal for patients who don't have that much fat in terms of volume and they just want more definition. Mm-hmm. So yes, certainly I do those in selected patients and with great results.
Amazing. And what about scarring and the tissue after the surgery? Do you see any scars on the body, or they are minimal?
So the scars from liposuction, if planned properly, are almost invisible. I personally never place the scar in an area which one can see the scar. So I would hide them in the belly button area and the groin crease, for example, or in the armpit. And these scars are less than 2 millimeters, so over time you won't even see them at all. But of course, after surgery, there's an initial healing period. Mm-hmm. So for up to 6 weeks to 3 months, the scar is visible. Give it 6 months onwards to a year, it fades away to almost, you don't even see it.
Amazing. Thank you so much, Dr. Adnan.
My pleasure.